Hello everyone, welcome back to my channel Health Pioneer, and this is Dr. Astha Hussain. So let me begin today by asking a very simple question, and that is, why is it important to know about your health? Now that sounds like a very rhetorical question, but surprisingly, majority of the population is not aware of their current health status. So once you've figured out why it is important to know about your health, then only can you move on to know how can you figure out what your health status is, and finally, what steps you can take to maintain your optimum health level. The major components in knowing about your own health status is to know about your family's health status. So in other words, knowing about your family's medical health history. Of course, we know exercising is very important. We know eating a healthy diet is very important. But knowing your family history is one of the strongest factors when it comes to the development of chronic medical conditions like diabetes, asthma, heart disease, cancer, all of these. Now, it's very obvious why that might be the case, because when you're living in a family setting, we're sharing the same lifestyle patterns, we're sharing the same characteristics, traits, genetic makeup, we're sharing the same eating patterns. So whenever you notice a medical condition pop up in a family member, there are just general few questions that you should be asking. Is that medical condition developing earlier than it is supposed to be? And is that condition occurring in more than one of your close relatives? And of course, are there certain conditions that are linked together? So for example, heart disease is usually linked with diabetes. Ovarian cancer usually occurs with breast cancer. Now, the point of knowing this is that when you're aware of the medical health pattern of your family, you can take necessary precautions beforehand, before certain conditions develop inside you, so that you can take necessary steps to make certain lifestyle changes, or you can talk with your doctor and see if there are any screening or detection tests that can be performed on you earlier than what it's supposed to be. And of course, with that, you will maintain your healthy diet, you would quit smoking, and you would get involved in regular exercises. Another important reason why you should know about your health status is because it helps us reduce the associated healthcare costs. Now, that sounds counterintuitive, but if you give it a thought, it actually makes a lot of sense. You see, when you're meeting with your doctor at a regular basis, you're following through certain tests on a regular basis, and you're following a healthy lifestyle and you're acting health conscious, you're actually cutting out the time you spend on your health care, as well as minimizing the amount of money you're investing in your healthcare. Now, to give you an idea of how much healthcare cost is associated with certain medical conditions, I have pulled out the data from CDC here. So at the very topmost position is heart disease and stroke. And roughly in a year, almost 1 million people die from this condition. And the amount of healthcare cost associated with it is roughly $200 billion, plus 150 another billion that is just lost in productivity or is associated with job loss. At the second position, we have the condition of cancer. Now, almost 2 million people each year are diagnosed with cancer, and the associated healthcare cost there is roughly $174 billion. At the third position comes diabetes. Now, the associated healthcare cost with that is roughly $34 billion, and 32 million people are actually diabetic each year, and additional 88 million people turn out to be pre-diabetic. That means eventually they will also end up developing diabetes. At number fourth, we have obesity, which is not very surprising. The overall healthcare cost associated with that is $150 billion, and roughly 20% of children are obese, and roughly 45% of adults fall in the category of obesity. And last but not least, at the fifth position comes arthritis. Now, the associated healthcare cost with that is roughly $300 billion, and that was back in 2013. And the population is roughly 1 in 4 adults, which is about 54 million people. Now, this estimate is based on the American population only. That we know why it is important to know about your health, the next important aspect is to know how you can figure out your current health status. So there are basically 4 numbers that you must be aware of, and those numbers are your cholesterol number, your blood pressure number, your blood glucose number, and your BMI index number. So let's begin by talking about your cholesterol number. So we all know what a heart attack is. And sometimes we think that it happens spontaneously, it doesn't happen for a specific reason, but majority of the times heart attack happens after several years of high cholesterol level and increased fat deposits in our bloodstream. So basically over time these deposit and clog the blood vessels, and gradually they cut off the blood supply to our heart, which leads to a heart attack. So that's why 3 numbers are important to know here. That is your LDL level, your HDL level, and your total cholesterol numbers. So number 2 is knowing your blood pressure number. So in simple terms, blood pressure is basically the pressure against which the heart has to pump the blood in the body. So the higher this pressure, the harder the heart has to work. Now remember, heart is just a muscle, and it can change its shape and texture if it is working too hard, to a point where it might not be able to compensate for this continuously high level of blood pressure. And remember that this increased pressure also leads to damage in the fragile blood vessels that are innervating our vital organs. So our kidneys, our brain, and our eyes. And that leads to organ damage, so eventually causing stroke, kidney disease, and vision problems. Number 3 is knowing about your blood glucose number. Now, glucose is the main source of energy for our vital organs. So it's always traveling into the bloodstream, and it remains attached to the hemoglobin component of it. Now, naturally, our body is very well adapted to maintaining an optimal level of blood glucose by manipulating a hormone called insulin. But there are conditions when this hormone insulin is not able to function properly or is not being produced in adequate amounts, in which case there is a constant rise in blood glucose level, which is referred to as diabetes. Now, it is not enough to understand that we have diabetes. We need to be aware of the associated risk factors, and that includes being more than 45 years of age, being overweight, or leading a very inactive lifestyle. You have increased blood pressure, or you have high cholesterol levels, or you have a family history running in your family, you have people or relatives with diabetes, or your background is Native American, African American, or Hispanic. It is also important to note the associated symptoms with diabetes. So you will have increased thirst, you will be urinating a lot more frequently, you will feel a lot more hungry, and you'll be losing a lot more weight with it. And you might also be noticing some blurry vision. Now, what does this all lead to? So over time, if this blood glucose remains high and it remains uncontrolled, it can lead to eye damage or blindness. It can lead to heart disease, kidney disease, and at very extreme conditions, it can lead to foot ulcers or even amputations. But not the least, know your BMI number. So BMI is basically calculated using your height and weight, and it basically roughly measures the amount of fatness that is present in your body. Now, why that is important is because obesity is linked with a condition called metabolic syndrome. And metabolic syndrome is basically a cluster of common medical conditions like high blood pressure, heart disease, high cholesterol level, of course, obesity, as well as diabetes. So when you know your BMI number, you can significantly reduce the risk of developing this metabolic syndrome. The next most important aspect here is the steps you need to take to maintain optimal health. So the first thing you need to do is quit smoking if you're already smoking. And that is because quitting smoking significantly reduces your risk of developing heart disease, lung disease, and stroke. The second important aspect is to eat a healthy diet. And that is because just as little as 5 to 7% loss of body weight actually prevents you from developing type 2 diabetes in some cases, or delay the onset of the development of type 2 diabetes. Now, what is a healthy diet? So basically, you're trying to incorporate a lot more veggies and fruits into your diet. You want to try to take more whole grains and increase your fiber intake. Try to take low fat dairy products, increase your intake of seafood, and if you're trying to go towards eating meat, stick to the leaner version of it or the white meat. The next important aspect is to maintain some level of exercise. So according to the guidelines, it is recommended to have at least 150 minutes of exercise in a week. Now, some of the examples of moderate exercise is brisk walking, jogging, swimming, yoga, or even high intensity interval training. The next important aspect is to minimize your alcohol consumption. Now, what is a normal alcohol consumption? So that is 2 drinks for men and 1 drink for women. So what is it that you can actually take? So that would be 12 ounces of having beer, or 8 ounces of having malt liquor, or 5 ounces of having beer, or 1.5 ounces of having 80 proof distilled spirits. The next important aspect is to get your screening tests done. Be updated with your screening tests. And those tests can be diabetes or for cancer, depending on your risk factors or your family history. And last but not least, maintain a good sleep hygiene. That is, get at least 7 hours of sleep each night and try to de-stress yourselves with meditation and try to incorporate breathing exercises. Establish the importance of knowing about our health status, which is beneficial for personal gains, but there is another angle to it, and that is it is important to know about our health so we can have a more engaging conversation with our doctors the next time we visit them. Because have you ever left your doctor's office thinking what you guys have just talked about? Do you have any idea how you're going to deal with your medical health condition? A typical patient remembers less than half of the information they have just discussed with their doctor. And multiple studies have shown time and time again that Americans, roughly 90 million of them, have a very low knowledge of basic health information. And that barrier actually affects people of all ages, races, income, education level. It's affecting everybody. And that causes poor adherence to prescription medications or improper use of medical devices. It increases hospitalizations, it increases visits to the emergency rooms. Solutions to this problem is to establish better communication. Now that can be performed by modifying the medical education and the clinical skills training that doctors receive, where the focus should be on the communication skills. So in a doctor's office setting, basically what doctors should do is communicate regularly with the patients, whether they have understood the information they have just received from the doctor. Apart from that, doctors can provide some written materials, something that the patient can go over at home or discuss with their family members. And also, the patients should increase their knowledge of basic health information so they are better able to discuss it with their doctors the next time they meet. Aspect is that the patients can themselves be more proactive and try to take lead. So they can continuously ask their doctors about information, whether they have understood or not. They can ask questions. They can step up and talk to the doctor and clear their confusion. If they're asked to use a medical device, they can demonstrate how they're about to use it at home. They should be allowed to take notes or video record the conversation so they can discuss it with somebody else if they wish to, some other doctor or a family member if they want to. So to just wrap up this video, I would like to mention some reputable sources that you can always access if you're trying to receive more health information, and that is the National Library of Medicine. You can also access the US Department of Health and Human Services. You can also check out the website of Mayo Clinic as well as the Canadian Health Network. Questions or concerns, you can connect with me in the comment section or get in touch with me online on my blog or social media. All the details will be provided below. I'll see you in my next video. Till then, towards your health and happiness, this is Dr. Asta Avisen.